the team has put together a little potpourri of different diets along the way. And so I'm really excited to know of, there's a lot of good diets out there. So we're just going to run through a series of them. So Steffi, take it from now.
All right. Thank you, Dr. Kernew. So hi, everyone. Welcome to the Cooking Club. Today we're going to be helping you learn how to choose a diet. Next slide, please. So how exactly do you choose a diet? There is so much information online, so it can be super overwhelming to know what's best for you. And then you may wonder what source is reputable. Is this going to work? Well, don't worry. We have researched a bunch of very popular diets and compiled all the information so that you can just watch it and then decide yourself. In today's presentation, we're going to be talking about the DASH diet, a diet targeted for hypercholesterolemia, triglyceride-lowering foods, the Atkins diet, and much more. So I'm Steffi. I'm a McMaster student. I've been a volunteer at the clinic for a couple years, and the rest of the team is going to introduce themselves as well.
I'm Helena.
Say a few words about yourself.
I've been also volunteering at the clinic for some time now, and it's my second or third appearance at the cooking club, and I'm really excited to show what we have prepared.
I'm the guy that's been around for a long time, trying to convince you to eat better, exercise more. So before I forget, we're going to have some exercise sessions. We have the exercise club starting. It's going to be on Wednesdays from 7 o'clock. So exercise with us. I'm also joining the weight loss club on Tuesdays at 7 p.m. And so I walk for an hour. I usually do the Shadok stairs. The other times is at 6 o'clock on Monday mornings. That's a.m. We do the Shadok stairs. So come join us. Now, where I just got thrown in over here, I learned this from Chad. I'm not sure if you can actually see this at all. This is actually vegetable soup, and what I just put in vegetable soup is just spinach. Lots of spinach, and I put some extra chicken broth. So I want to encourage everybody to eat, drink, and be merry, but do the right foods right now. And of course, the number one beverage is water. So lots to learn about diets right now. So I'm trying to get to my goal weight of 165 pounds. I'm up a little bit, but hopefully this time in a couple weeks I'll be back down to that level. So that's who I am. Who's next?
I can go next. So, hi everyone, my name is Aditi. I've been a volunteer at the clinic for a couple of years, joining the cooking club again for a presentation today on another occasion. I think I've done 1 to 2 in the past, so I'm glad to be back and discussing diets. And yeah, that's a little bit about me.
And our last member is Shannon, who's also here. She has been a part of our cooking club in the past, and we're all really excited to present today's topic.
Hi, thanks Steffi for that introduction. I think I was muted, I didn't realize.
Do you want to say something about yourself, Shannon?
Sure. I'm in my 3rd year of health sciences at McMaster. I've been volunteering for the clinic for about 1.5 years now, I think, and I'm really excited to be part of the cooking club again.
Well, I'm looking forward to really trying to figure out how to pick a diet and how to change a diet and how to adapt a diet. There's so many things out there. We'll enter a little bit of everything, and we're going to come back in more detail with some of these diets at later dates. But we just want to show you what's out there, what you should think about, and how to choose.
All right, so we're going to be starting out with the DASH diet, and DASH stands for Dietary Approaches to Lowering Hypertension. So what exactly is the DASH diet? As mentioned, it's a diet that is used to lower hypertension. It's flexible and balanced eating plan. It's sponsored by the National Institute of Health to help you lower your blood pressure. When you're following the DASH eating plan, it's important to choose foods that are low in saturated and trans fat, rich in potassium, calcium, magnesium, fiber, and protein, and lower in sodium. And most notable about this diet is that it has been proven through studies to lower your blood pressure by a few points in 2 weeks and up to 8 to 14 points over time. So one of the most...
That's remarkable. Go back one slide. So people always say how to use less medications. So dietary approach to stopping hypertension shows that you can lower blood pressure as good as one medication. Now, for people who have high blood pressure, often need combinations of drug therapy. So DASH is one of those top-ranked diets. So this is actually a very healthy diet. It's designed to lower blood pressure. It can also lower cholesterol and other health benefits as well. But so this is the way to use less medications to control your blood pressure. Go ahead there, Steffi. Sorry.
No, of course. So one of the most preliminary trials that was done was actually in 1999, same year I was born, but it's the DASH trial that was sponsored by the National Institute of Health. And here in this trial, they compared 3 diets. They had their participants standardized to either having a typical American diet, a typical American diet with more fruits and vegetables, or a DASH diet. So during this time, all the meals were provided to the participants, and after 2 weeks, the participants who added fruits and vegetables to a typical American diet or those on the DASH diet had lower blood pressure than those who followed the typical American diet alone. However, the participants on the DASH diet had the greatest effect of lowering their high blood pressure, and follow-up reports from the DASH trial showed that in addition to improving their blood pressure, as Dr. Kearney mentioned, the DASH diet also lowered their LDL cholesterol levels. So this was a really great trial that was really the foundation for the research that was conducted in the future. So if we go to the next slide, you can see that more research has been conducted that backed up these results. A systematic review, which is the highest grade of evidence, was conducted, and it looked at 17 randomized controlled trials where participants were on the DASH diet, and there was a total of 2,561 participants. It was found that overall the DASH diet significantly lowered systolic and diastolic blood pressure by 6.74 and 3.54 points respectively. These results are highly supported in favor of implementing the DASH diet in improving high blood pressure.
So let's just pause, go back one more slide. So if you have high blood pressure, you can get between 5 to 10 millimeters of blood pressure lowering. I'll repeat that. You can get between 5 to 10 millimeters of blood pressure lowering. So for people who have serious high blood pressure, it will probably not be enough, but it's certainly a way of using less medications and to incorporate this into your lifestyle changes. And there's actually data, if you start this diet now, you can probably prevent the onset of hypertension or delay the onset of high blood pressure in your life. So we're going to say that most Canadians, 90% of Canadians, will develop hypertension in your lifetime. So a DASH diet is a way of preventing high blood pressure. It's also a way of lowering blood pressure. So just think about if that fits into your dietary scheme. Go ahead there, Steffi.
All right, so why does it work? Well, the DASH diet possibly increases the compound nitric oxide in your blood, which helps relax the vessels. In addition, it helps promote sodium loss, known as natriuresis, which may occur due to the additional potassium intake that you receive through the diet. Potassium has been found in other trials to help reduce blood pressure. So this process starts to occur before the end of the first week when you're on the DASH diet. In addition, antioxidants are enhanced, which further protect the blood vessels. DASH has also been found to decrease pulse wave velocity, which represents arterial stiffening. Heart PWVs predict cardiovascular disease mortality. And lastly, DASH helps conserve calcium from the urine, which also contributes to lowering the blood pressure on the vessels. So as you can see, there's a lot of mechanisms in the body the DASH diet targets, so that's why it's really great for lowering hypertension. So if you go to the next slide, we have a really great image here. So how exactly do you measure blood pressure? Before I explain this process, I want to ask a question. Can you have a normal blood pressure at home and then a high blood pressure at the clinic?
Stuart, what do you think? Because most of the time people get the white coat hypertension, they say. They think the blood pressure is always high at the doctor's office, but never high at home. But Steffi asked a reverse question. Can your blood pressure be good at the doctor's office, but high at home? What's your thoughts?
Yeah, it's a good question. It's quite unconventional, you would think, because you'd think obviously the opposite. But I would say it's certainly a possibility. I think you're going to give me the answer right now, though.
Yeah, it's called masked hypertension. So this is actually your blood pressure can be high only at home, not the doctor's office. And if you don't recognize it, it increases your risk of having a heart attack or stroke. And we also know that blood pressure can be low in the morning, high at nighttime. And that's basically your blood pressure should fall at nighttime. So people who have sleep apnea, people who snore, poor sleep, stop breathing at nighttime, as their body starts to accumulate acid because you're not breathing properly, the blood pressure goes up. And so you don't want to rely on just a blood pressure measurement in the doctor's office. So my plea to every Canadian is that you gotta get yourself a good blood pressure machine, learn how to use it. And I don't want to hear anymore, well, it's always normal. Well, we just said that 90% of Canadians at some point will develop high blood pressure. Blood pressure kills. Blood pressure causes stroke, causes heart disease, causes kidney disease. And so this is just an example how you can start to measure it. We have about 6 videos that talk about blood pressure in some way. Spend the time to learn about that. The other thing too is that if you get dizzy when you stand up, well, measure your blood pressure when you're standing up and see what the difference between standing and sitting. Measure these, be a detective. Someone says I'm getting dizzy all the time, and their blood pressure is normal when they're standing up. Well, it's not because of high blood pressure. But if your blood pressure is 130 over 70 when you're sitting and it goes to 90 over your 60 when you're standing, that's important information. And what happens when you're at the doctor's office, you have these surges of catecholamines, things that are always higher at the doctor's office, higher at the dentist's office. So you want to get your blood pressure in multiple places, multiple locations. So this is a plea to learn how to measure blood pressure properly, as Steffi points out over here, and she'll talk about that a little bit more, I think. But please, please, please think about getting a blood pressure machine. And if you have a real friend, get them a blood pressure machine that's approved by Canadian Hypertension Society. Thanks a lot.
Yeah, so as Dr. Kearney mentioned, it's super important to measure your blood pressure both at the clinic and at home because these values can vary and it's really important to keep track of that. So how exactly do you do it? First, you want to make sure you measure your arm to get your cuff size. So you can do this by taking a tape measure and get the circumference of your upper arm, and then you select a cuff size that includes this measurement. And then once you have your cuff and your blood pressure machine, you want to take it home and then find somewhere to sit down. They recommend resting for about 5 minutes before you take it, and sit down and have your cuff on your arm and have it nice and snug but not super tight, and it can't be loose. You have your arm down on the table, it should be at chest level, and then you press on and turn it on. And then while you're taking your blood pressure, you want to make sure that you're not talking, as this can cause some inconsistencies in the results. And we always recommend at the clinic to take your blood pressure more than once. We do it 3 times. You can do it, that many times or even more if you want. And yeah, that's how you take your blood pressure.
So you don't take your blood pressure when you're talking to the doctor, like myself, because that brings it up. And you don't take it once, you take it multiple times. And guess what? Your blood pressure should vary. That means you're human. If it's always the same value, you're probably dead or about to die. So the fact your blood pressure can actually change is a good thing. So it's not a static number. It's sort of like the average blood pressure. So thank you for sharing that. So again, measure your blood pressure often, many times, and chart it down. And you can actually lower it. You can lower it by meditation, relaxation. You can lower it by a DASH diet. You can prevent the development of high blood pressure by a DASH diet. Thanks so much, Steffi.
So now we're going to be talking about sodium restriction, which is the key of the DASH diet. The Mayo Clinic suggests 2 streams of the DASH diet. The first is standard sodium, which is up to 2,300 milligrams of sodium per day. And then the second is the lower sodium, up to 1,500 milligrams of sodium per day. The second measurement, 1,500 milligrams, is recommended by the American Heart Association, especially if you have cardiovascular diseases. Another point I wanted to bring up when talking about the DASH diet is you want to continue to calorie restrict. You don't want to be eating twice as much as you normally would just because you're on this diet, because you're not going to lose weight by doing that. It's specialized in targeting high blood pressure, but you also want to make sure you're not gaining additional weight, as that can also increase your risk factors for heart disease. So now if we go to the next slide, what might a DASH plate look like? So I have an image here. You have a quarter of chicken, a quarter of grains, and half a plate of fruits and veggies. As mentioned, the goal of the DASH is to reduce sodium and increase the nutrients that you have in your diet, such as potassium, calcium, and magnesium. Some examples of foods you could eat on this diet are whole grains, fruits, vegetables, low-fat dairy, fish, lean meats, poultry, beans, and nuts, but be mindful because those can add up on calories very easily. So when you are eating nuts, make sure that you're not eating more than a handful. So if you go to the next slide, I have an image of the old Canadian food guide, and as you can see, it's changed a lot from what they now recommend. The biggest category here is grains, and the smallest is protein. And this is much different from the newer one if you flip to the next slide, where the portions have drastically changed. Now grains take up only a quarter of the plate, and fruits and veggies take up half. This looks very similar to what a typical DASH plate may look like, but you do have to be mindful of including the dietary items recommended for the diet. Now, one thing I wanted to highlight with this image was the beverage of choice that you eat with each meal. It should always be water. Now, I've put some common drinks that people may have with their meal and the calories. As you can see, by adding a glass of orange juice or wine, you're adding about 100 calories per glass. Now change that to coffee or hot chocolate or the Oreo milkshake from Burger King, which is almost half of your recommended calories for the day. It's over half if you're following the recommendations for people with cardiovascular disease, which is about 1,600 calories per day. So now the reason I brought this up is to urge you to drink water, because you don't want to be adding additional calories through the liquid that you're having with your meals.
So it's interesting how the chicken guidelines have changed, and that plate of the main ingredient now is, is fruits and vegetables. So I'm having a DASH diet for dinner. I have vegetable soup. I've added the Chad special of spinach to everything, and I've added some extra low-calorie chicken broth, and I had one that's actually sodium reduced. This is 35 milligrams per serving. You can get 0 if you want to. And remember, you want to replace salt with potassium. And basically, potassium is fruits and vegetables. Anything that's green and leafy is full of potassium. So salt brings up blood pressure, potassium lowers blood pressure. So that's part of why DASH works. And it also improves the health of your endothelium, as you point out there too as well. I'm trying to drink lots of water. I'm a great big coffee drinker, black with a little bit of milk, but I'm trying to replace that with more water.
So as mentioned, a key component of the DASH diet is calcium, as it is an essential nutrient. Calcium has many functions in your body, ranging from bone health, as 99% of your body's calcium is stored in your bones and teeth, heart function, as calcium keeps your heart muscle pumping, and nerve transmission, as calcium fires cell signals that help muscles contract. Keeping all these systems in peak condition requires a diet rich in calcium. Just how much you need depends on your age. Women under 50 need 1,000 milligrams daily, and men under 71 also require the same amount. And as you get older, you require more calcium. So women older than 50 and men older than 71 need about 1,200 milligrams every day. Older adults need more calcium to protect their bone health and starve off osteoporosis, which is a common bone disease that can develop as you age. So if you're unable to consume dairy for whatever reason, here are some calcium-rich alternatives. I also wanted to mention a pro tip. If the label on the food item that you're purchasing states that the product provides, say, 30% of your daily calcium requirement, you can add a 0 to find out just about how much that is in milligrams. So in this case, 30% would be about 300 milligrams. So that can help you with estimating how much calcium you're having per day. So for food recommendations, you want to have canned sardines, for example, but check the label to make sure they're canned in oil with the bones included. Fortified foods contain added vitamins and minerals that are naturally present in the food items, so they can help you get that calcium intake up as well. So some other examples of foods are fortified soy, almond, and rice milk. There's some great alternatives to dairy milk if you're lactose intolerant, which can also be added to your daily coffee. Fortified orange juice, but you want to check the label because not all orange juice is fortified with calcium. Tofu made with calcium sulfate, canned pink salmon with bones, fortified cereals, and English muffins. Now, this one I wanted to mention to be mindful because that can be quite high in sugar, but if you want your occasional treat, make sure that it is one of the more healthier varieties of those muffins. So check the label. And greens such as turnips, collard greens, and kale all pack calcium-rich punch. Beans like garbanzo, kidney, navy, and even canned baked beans provide calcium. Boiled green soybeans are another good option. Canned shrimp. Veggies like cooked broccoli, Chinese cabbage, edamame, and acorn squash. And finally, papaya, dried figs, and oranges. So as you can see, it doesn't matter if you're lactose intolerant. There's so many ways that you can get some calcium into your diet. And these are just some of the examples that you can implement.
Well, thanks for sharing that, Steffi. Interesting. Calcium has now become a controversial area. Should I have dairy? What about calcium? So we're going to actually review that in more detail. But one of the things, for instance, when I have canned sardines, I have mine packed in tomato sauce because I want to pay attention to the oil. And if you have the bones, you get the calcium that way as well. And there's now associations with calcium for prostate cancer, for instance, in males. There's also calcium could cause risk of heart disease and bone health, etc. So it appears that getting calcium from food is more beneficial than getting calcium from supplements. So it's really, there's been a great change right now. Once on, we thought that calcium was so important and vitamin D for bones. It may be less important. Exercise, weight bearing might be the most important thing. So I love this. I love this slide and take a picture of this. So I'm trying to get more of my calcium from non-dairy sources as well. And there's a lot more to come right now, but we believe that calcium does lower blood pressure. And if you look at vegetarians, they have less calcium intake compared to meat eaters. And they do have more bone fractures, it looks like, too, as well. So we're learning a lot. But if you have, dairy products, you may have more prostate cancer. So we have a lot to weigh right now. So I'm trying to get my calcium from many of these ingredients that you talk about have a lot of health benefits as well. So, for instance, I don't drink orange juice. I eat the orange. If I'm going to have sardines, I make sure I eat the bones because it has the calcium content. That and lots of those fruits and vegetables can have some calcium too as well. And look at fortified food. One time, like if you're buying your soy milk or oatmeal milk, make sure it's fortified with calcium as well. So thank you for sharing that. So calcium is important. How much you should take is still we're learning and. I've actually reduced my dairy calcium and I increased my non-dairy calcium over time.
So now if you go to the next slide, I'm going to be showing you an example of a DASH diet meal that you can actually make called a Mexican bake. So in terms of nutrition, this is super healthy. This is for one person. It's only 325 calories. And if you look at the sodium, 356 milligrams of sodium. So that's quite low. You'd be surprised if you go and purchase something from the restaurant or something like that. The sodium can be like 1,000 milligrams just in one meal. So that's why you should really try to get into cooking at home because you can keep track of how much of each ingredient you're adding. So for what is included in the meal, you have 1.5 cups of brown rice, a pound of skinless, boneless chicken breast, which can be cut into small chunks. That's also optional. You can have this as a vegetarian meal if you like. Cans of tomato diced or crushed, 1 can of no salt added black beans, 1 cup of frozen or canned yellow corn kernels, 1 cup of chopped red bell peppers, chopped poblano pepper, which is also a dish optional if you like your spice, a tablespoon of chili powder, a tablespoon of cumin, white onion, garlic cloves, and some cheese, which is also optional. So this meal gives you the option to customize it to your likings. So it's really simple to make it. All you have to do is preheat your oven to 400 degrees, and you spread the rice in a shallow 3-quart casserole dish, and you top it with chicken. And then in a bowl, you combine all of the ingredients, the tomatoes, beans, corn, pepper, seasoning, and garlic, and you pour that over the chicken. You can add that additional cheese if you would like, and bake for 45 minutes. So it's super easy, and it's one of the DASH diet foods because it's very low in sodium and high in those essential nutrients.
Yeah, so now I'll just take over and talk more about a low cholesterol diet. Next slide, please. Yeah, so a diet that limits cholesterol intake is important since too much cholesterol causes plaque buildup in the artery walls, and it's more difficult for the heart to circulate blood through the arteries when there is that buildup. And this plaque buildup can also cause blood clots, which can lead to strokes or heart attacks. So changing our diet is an effective way to become healthier and lower our cholesterol levels. And in a study conducted by researchers in France, they found that dietary recommendations have an impressive impact on cardiovascular events, and the effect on LDL cholesterol is too great to ignore. So they discovered that implementing the Step 1 diet, which is a diet recommended by the National Cholesterol Education Program involving a reduction in calories of 500 to 1,000 calories a day, helping to achieve a weight loss of 1 to 2 pounds a week, reduces our LDL levels by 10%, and dietary fibers lowered LDL levels from 5 to 10%, nut consumption decreased the levels by 8%, and lastly, soy protein reduced levels from 3 to 10%. Next slide, please. So what are some food options that you can go to? Oatmeal is a great option since it contains soluble fiber, which reduces your LDL levels, which is the bad cholesterol. And soluble fiber is also found in foods like kidney beans, Brussels sprouts, apples, and pears. And soluble fiber can reduce the absorption of cholesterol into your bloodstream. So 5 to 10 grams or more of soluble fiber a day decreases your LDL cholesterol. And one serving of a breakfast cereal with oatmeal or oat bran provides 3 to 4 grams of fiber, and if you add fruit such as a banana or berries, you'll get even more fiber. Almonds and other tree nuts can improve blood cholesterol as well. A recent study concluded that a diet supplemented with walnuts can lower the risk of heart complications in people with a history of a heart attack. And all nuts are high in calories, so as Steffi mentioned, we need to be careful with how much we consume it, even as a snack. So a handful is recommended in addition to a salad or eating it as a snack. Avocados are also a great source of nutrients as well as monounsaturated fatty acids, and research suggests that adding in an avocado a day to a heart-healthy diet can help improve LDL cholesterol levels in people who are overweight or obese. And people tend to be most familiar with avocados and guacamole, which usually is eaten with high-fat corn chips. So maybe try avoiding that and adding avocado slices to salads and sandwiches or eating them as a side dish. Next slide, please.
So the trick about these diets is that if you just go back one more slide, the traditional heart and stroke diet was to eliminate cholesterol content of food. So things like butter, saturated fat, egg yolk. So again, is that it looks like cholesterol content and saturated fat may not be as important as first thought, but there's some of us that hyperabsorb cholesterol and are affected by saturated fat. So what I'm recommending is 3 to 4 eggs total a week, but a lot more egg whites, for instance. When it comes to things like dairy fats, since I'm trying to eat less dairy to start off with, but I still eat some dairy, I try the low-fat version because the high-fat version, for instance, a glass of skim milk is 90 calories. Regular milk is 160 calories, so I'm trying to get the calories down. I think the calories are one of the crucial factors for for many of us. I don't use butter or margarine. I don't add oils to my food. I just try to eat food in their natural states. Interesting things like now there's some controversy about dairy fats and avocado, for instance, for health and weight reduction. Problem with avocados, it's rich in monounsaturated fat, and that lowers LDL cholesterol, but you got to be careful with the calorie content. Same thing as in nuts right now. So I like the idea if you're going to have avocado, careful with the amount that you're eating. Don't eat too much of it, and avoid the chips and everything else that goes with it. Absolutely. So great pearls of wisdom right now. So so these are foods that can lower your LDL cholesterol, but you have to be confident that you're keeping your caloric intake as well. So thank you for sharing that. Next slide. Thank you.
So as Dr. Kearney just mentioned, getting the full benefit of these foods requires other changes to your diet and lifestyle. And one of the most beneficial changes is limiting that saturated and trans fat you have in that diet. And saturated fats such as fats in meat, butter, cheese, and other full fat dairy products raise your total cholesterol levels, so decreasing your consumption of saturated fats to less than 7% of your total daily caloric intake can reduce your LDL cholesterol levels by 8 to 10%. Trans fats are often used in store-bought cookies, crackers, and cakes, and they raise overall cholesterol levels as well. So be careful when you do eat these foods as a snack, and honestly, you do want to avoid them as much as you can. And on this slide, I have an example of what a low cholesterol meal would look like throughout the day. And the picture on the right is showing the dinner option of the salmon with sweet potatoes and broccoli. And Eating Well is a website you can find to help you with meal prepping low cholesterol foods throughout the week for each meal of the day, including snacks. And they provide step-by-step instructions on how to cook the meals, as well as the calories that you're consuming with every meal and every snack, like you can see on the slide here.
So next I'll be talking about diets to lower high triglycerides. So we'll start by discussing what triglycerides are. So they're a type of fat. They're basically derived from your 3 fatty acids and your glycerol. When you eat, your body converts any calories that you don't require right away into triglycerides, which get stored in your fat cells. So triglycerides enter your blood when they are released from fat stored in your body, usually for energy. You eat excess fat in your diet, or you eat extra calories that are not used for energy. And we often think about cholesterol when we think about lowering the risk for heart disease, but triglycerides are also an important component. High triglycerides are associated with an elevated risk for developing heart disease, so it's another thing that you need to monitor in your diet as well as in your lab work. So these are just some factors that can cause high triglycerides. Being overweight is a contributing factor to high triglycerides. Also, eating too many foods that are high in carbohydrates. Studies have shown that sugars from carbohydrates can be converted into triglycerides in your body, so you want to try and reduce that within your diet. Sugary drinks are another source of unnecessary added sugar that can contribute to high triglycerides. The high consumption of unhealthy or saturated fats can also contribute to high triglycerides. Alcohol has been linked in numerous studies to be a factor that contributes to high triglyceride levels. They found a positive association between increased alcohol consumption and increased high triglyceride levels. And lastly, diabetes or kidney disease and genetics are 2 other factors that can contribute to having high triglycerides.
It's kind of interesting that it's hard to lower your LDL, your bad cholesterol, with diet. It's much easier to lower your triglycerides with diet. So one rule of thumb that anything that is white, make it green. 60% of calories are often processed food. So you mentioned that the sugary drinks, the cookies and things, they taste great, but they're bad for your fats, your diabetes. And unfortunately, alcohol has one of the biggest contributing factors to triglycerides. So if you have a triglyceride level that's greater than 5, be careful that alcohol should not be part of your eating habits. And last week we just did a great webinar on alcohol. Take a look at that. And people are surprised to know that alcohol is not a healthy food anymore. At one time it was. Now it causes cancer and it causes atrial fibrillation and medical problems. And it makes triglycerides a worse issue right now. So other ways to lower your triglycerides, of course, exercise. So this is a wonderful slide. Pause, take a look at that. And these are some of the things that you can do to change that. Thank you.
So now we'll discuss how you can reduce your triglycerides with diet. So the first recommendation is limit foods high in sugar. So avoid sodas and fruit juices. If you're looking for like that sugary kick, try to get it from a whole fruit instead. And it's recommended that you eat no more than 6 teaspoons for women or 9 teaspoons for men of added sugar. The next recommendation is avoiding trans fat or saturated fats. These are considered to be like your bad fats. Instead, you want to increase your intake of unsaturated fats. And these are found in most oils, so something like olive oil, avocados, nuts, seeds, and fish. Again, as we've mentioned before, these are good sources of unsaturated fats, but they're also high in calories. So just make sure that you're taking that into account when you're including any of these elements in your meal.
One word about olive oil. It has to be a good quality olive oil. So you want cold pressed extra virgin olive oil. It's a lot more expensive, but that's the ones that come with the health benefits. So personally, I try to avoid any extra oil. I just eat foods that are rich in olive oils. One of the words is called olive instead of olive oil.
So a few other recommendations. You want to reduce the portion size of starchy foods, so grains and vegetables. These are things that you would normally consider to be good in your diet, but there are certain vegetables and grains that you would want to reduce your portion sizes for in order to reduce your triglycerides. So examples are bread, potatoes, pasta, cereal, rice. These sugars can become triglycerides if eaten in large amounts. So 2 to 4 servings per meal is what's recommended to lower your triglycerides. And another great thing to do is for like pasta and rice, instead of having white pasta or white rice, switch to like brown rice or brown pasta, because that adds extra fiber, which I'll get into on the next slide, which is also beneficial in reducing your triglycerides. And the next recommendation is adding in protein. So protein is not only a beneficial thing to consume because it's an important nutrient that you need, but it also helps you feel full. So you're not as reliant on those large portions of carbohydrates to keep you full and satiated. So some good proteins to include are fish, tofu, nuts, beans, lentils, eggs, lean meat proteins, or low-fat dairy products. Again, just be mindful of the calorie content in some of these sources. As was mentioned earlier, if you're looking to lose weight on one of these diets, you do need to calorie restrict, which means eating less calories than you're burning throughout the day. So keep that in mind when selecting your proteins, because proteins like nuts can be really high in calories.
So myself is that the eggs have become a controversial area. So what I do is I limit myself to no more than 3 to 4 total eggs a week, a lot more egg whites. The number one source of protein that's good for you and your health and the planet is beans. So think about adding beans to your repertoire of foods.
And these are just the last couple of tips. So on the right, you can see a diagram of a plate. This is what the diet is recommended to look like if you're working on reducing triglycerides. You want half of your plate to be made up of vegetables, the quarter can be made up of protein, and then quarter starchy foods. And then in addition to structuring your meal like this, it's important to reduce your alcohol intake. So high alcohol consumption is associated with elevated triglycerides, and alcohol is often high in calories and sugar. Again, something that you don't need to be adding to your diet when you're looking to reduce your triglyceride levels. And the last recommendation is eating more fiber. So as Helena mentioned, fiber reduces the absorption of fat within your system, and fiber can also decrease sugar absorption. Fiber is found in fruits, vegetables, and whole grains, and a lot of beans are a really good source of fiber. So if you're considering going plant-based with your protein options, think about beans because they're a great source of protein and they also add fiber to your diet. And lastly, if you're looking for recommendations for recipes to help lower triglycerides, you're not always going to find hits on Google for like reducing triglyceride diet. But the Mediterranean diet is a good option to look to for recipes because it naturally focuses on cutting out sugar as well as emphasizing healthy fats, proteins, and vegetables. So you can look to some of the Mediterranean diet recipes for inspiration as you devise meals to help you reduce your triglycerides.
Yeah, so it's as sad as that I'm addicted to pasta and to bread, so it's one of the things I had to change. People who like eggs, be careful the amount of eggs that you eat. Alcohol, I always say like 3 to 4 eggs a week or 3 to 4 drinks a week would be a safe amount for most of us, and other people might need to restrict even differently. We're all a little bit different, but those are wonderful recommendations. Thank you so much. Beans, fiber are good things to have. Just remember, if you have lots of fiber, your neighbors know about that too as well.
So this is just a sample meal plan that was provided by the University of Wisconsin for reducing high triglycerides. So the recommendation for breakfast, think about eating egg whites if you're going to be eating eggs for protein. So 2 egg whites, a slice of whole wheat toast with peanut butter. If you're looking to have some fruit, have an apple and a cup of coffee. The recommendation is try to have it black or just with a little bit of milk. Don't add any sugar to it. For lunch, the recommended meal plan had salad with grilled chicken and some whole grain crackers if you're looking to add like a carbohydrate component to that. For snacks, going with low-fat or fat-free yogurt and berries is a good option. If you're looking to cut down on dairy, there are like plant-based versions of yogurt, so where they use like plant-based milks to make the yogurt, so that's also a good option to look at. And then for dinner, it was a baked or broiled salmon with brown rice and vegetables, and then another snack if you need one after dinner. Thinking about like low-fat cheese, fruit is a really good option. Or if you're kind of craving something a little more exciting, you can have popcorn, but the recommendation is unsalted and unbuttered.
So now we wanted to talk about fish. A really brief intro. Fish is a key component of a lot of different diets. The Mediterranean diet is recommended for DASH and also to lower your triglycerides. There's a lot of research around fish oils, and we're not going to get too deeply into that in this presentation, but probably in the future. But EPA and DHA are also prescribed to help individuals that have very high triglyceride levels lower them. So if you want to get your fish oils up naturally, you should be consuming fish. But what about contamination? That's something that's commonly mentioned in the media. There's a lot of warnings out there that all the fish is contaminated. So we wanted to share what we think so that this can help you make your decision on what you want to do about your consumption of fish. So I'll pass it off to Shannon.
Thank you, Steffi. So it is really important to be aware of some of the contaminants that can make it into the fish we eat. I know a lot of people who are really concerned about this, and it is true that certain contaminants like mercury, chlorinated pesticides, or other chemicals such as PCBs do make it into water sources and can end up contaminating the fish who live and feed in those areas. And in fact, some of those contaminants can remain in the body for up to 5 years, and are noted to be especially dangerous for pregnant women and their baby. However, even though this does sound really scary, yes, you should still eat fish. Fish is very nutritious, it's really beneficial to your health. It's low in saturated fats and high in proteins, vitamins, minerals, and omega-2 fatty acids, which are super important for the heart, brain, and your overall health. So since we're still wanting to eat fish, it's good to be educated about how we can avoid some contaminants in fish. And one way to do this is to eat a variety of fish that are known to be low in mercury. So this includes salmon, sardines, cod, tilapia, trout, and a bunch of others. You can very easily find a list on Google. You can also choose light tuna when buying canned tuna instead of white tuna or albacore tuna, because light tuna has been shown to have lower levels of mercury. And contaminants can also build up over the lifetime of a fish. So if you have the opportunity, if it's possible for you, you can choose to eat younger fish as well. So now moving on, we're going to be talking a little bit about the Atkins diet. So the Atkins diet is a popular low-carb eating plan that was developed in the 1960s. I'm sure many of you have heard of it. This diet works by restricting carbohydrates while simultaneously emphasizing protein and healthy fats in the diet, and has also recently evolved to emphasize high fiber vegetables. So the Atkins diet is usually followed by people hoping to lose weight or hoping to improve their cardiac health or both, and we'll be discussing a little bit later how effective the diet actually is for those goals. So in order to participate in the Atkins diet, you do need to track your net carbs. And net carbs is carbs minus fiber. So for example, a half cup, which is about 4 ounces of raw broccoli, has 2.3 grams of total carbs and 1.3 grams of fiber. So its net carb value would be 1 gram. And the idea is that with this diet, without as many carbohydrates, which are typically used by your body as fast energy, your body will be forced to use up its other energy stores, which is its fat tissue. However, because carbs do usually provide over half of the calories a person consumes during the day, the main reason for weight loss on the Atkins diet is very likely to be just an overall lower calorie intake. Like Aditi mentioned, on a diet, if you want to lose weight, you do have to calorie restrict. So this is an efficient way of doing that. You may also lose weight on this diet because food choices are more limited and the extra fat and protein in the diet allow people to feel full for longer. And lastly, an important thing to note about the Atkins diet is that they recommend that you consult your doctor before starting this diet if you take diuretics, which are water pills, insulin, or oral diabetes medication, and that you should not be following the diet if you have severe kidney disease. So what are the benefits of this diet? Well, the Atkins diet holds that eating too many carbs, especially sugar, white flour, and other refined carbs, can lead to blood sugar imbalances, weight gain, and cardiovascular problems. And according to the Atkins diet, obesity and related health problems like type 2 diabetes are the fault of the typical American diet, which has lots of sugar and refined carbs. And they say that these problems can be dealt with by controlling your carbohydrate intake. So the Atkins diet claims to be a healthy, lifelong approach to eating for losing weight, boosting energy, or helping to improve any health problems, such as metabolic syndrome or high blood pressure. And we'll take a look at what the scientific literature says about its cardiovascular benefits. But it is true that most diets that allow somebody to lose weight, including this one, do help improve blood cholesterol or blood sugar levels, at least temporarily. So what does the literature say about this diet? So we'll be talking about 2 studies. The first one is a 2017 study by Anton et al. This was a systematic review, which is a very high level of evidence, and it looked at the effect of many different diets on weight loss. So of 7 diets they looked at, which did not involve calorie counting, the Atkins diet actually was found to show the most evidence in producing clinically meaningful short-term and long-term results for weight loss. So this diet is fairly effective in allowing people to lose weight and keep it off, even in the long term. But interestingly enough, these findings actually counter the current recommendations of the Dietary Guidelines Advisory Committee. So this committee states that diets with less than 45% of calories as carbohydrates are not more successful than other diets for long-term weight loss. And this study by Anton et al. Actually did find that it may be difficult for people to stay on this diet. There was high rates of people dropping out, as well as a low adherence to the diet after the studies were over. So that's something to keep in mind. The second study we'll talk about is, again, a systematic review. This one was published in 2020, and instead of weight gain, focuses on the effects of diets on cardiovascular health. So this study actually found evidence that the Atkins diet can result in a significant increase in total cholesterol, specifically LDL cholesterol, and triglyceride levels were significantly reduced. However, timing was significant when it came to participating in the Atkins diet because although total cholesterol and LDL increased over the first 3 months of the diet, these values did return to normal within a year of being on this diet. So on this topic, it's still pretty vague and more research is needed. So we've talked about the benefits and potential drawbacks, but how do you actually implement the diet? So there's 4 phases to following the Atkins diet if you want to do it. Firstly, the introduction phase. So here you cut out almost all of your carbs. You eat just 20 grams of net carbs a day, which are mainly from vegetables. So now instead of getting 45 to 65% of your daily calories from carbs, you only get about 10% of calories from carbs. And what they call foundation vegetables, like asparagus, broccoli, celery, cucumber, green beans, and peppers, should account for 12 to 15 grams of these net daily carbs. So instead, you should be eating protein like fish and shellfish, poultry, meat, eggs, cheese at every meal. You don't need to restrict oils and fats on this diet, but you can't have most fruits, baked goods, breads, pastas, grains, nuts, or alcohol. And you would stay in this phase for at least 2 weeks, depending on how much weight you're losing. Secondly, you would enter the balancing phase. So here you continue eating 12 to 15 grams of net carbs of foundation vegetables, but you can slowly add back in nutrient-rich carbs like berries, nuts, and seeds. And you would stay in these phases until 10 pounds from your goal weight. Thirdly, you would enter the pre-maintenance phase. So here you continue to gradually add back foods, including fruit, starchy vegetables, and some whole grains. And you can add about 10 grams of carbs to your diet each week as long as you're still losing weight. And finally, you would enter the lifelong maintenance phase. And so at this point, you would supposed to be finding the amount of carbs that you can eat that would allow you to keep your goal weight and also not gain any weight back. And you would continue eating this way for the rest of your life, which is why the Atkins diet sometimes is a bit difficult to follow. So what would it actually look like if you were to follow the Atkins diet? Well, first of all, I want to say that if you are considering following this diet, I would highly recommend checking out this website at the top, www.atkins.ca, because they have 2 full weeks of meal plans, 3 meals a day, and 2 snacks all set out for you. But for example, on the Atkins diet for breakfast, you might have scrambled eggs with sauteed onions and cheddar cheese, and you could drink coffee, tea, or water. Again, making sure to track the carbs in from sugar if you're adding that, and probably not adding sugar at all. For lunch, you might have a mixed salad with chicken, bacon, and avocado dressing. And again, you could drink diet soda if you wanted because there isn't any carbs in that, but that is not very healthy for you by itself. For snacks, you can have 2 snacks a day on this diet, and those may include things like smoothies, granola bars, or more simple snacks like celery and cheddar cheese, or yogurt with fruit, or even a bagel with cream cheese. And then for dinner, you might have something like baked salmon steak with asparagus and arugula salad with some vegetables in there.
Now, if we just go backtrack one more slide, there are healthier forms of a high keto diet. To me, bacon cancer on a stick. Red meat, processed meats, we have some controversial areas about. I do think is that when I went on my keto diet, my wife said it wasn't a true keto diet because I didn't get down to the restrictions as suggested here. But what I did do is eliminate things like breads and pastas, and that makes a huge difference. And you do actually lose more weight quicker. Can this be sustainable? I found after a while, I miss my bread, I miss my pastas, and grains do have a lot of health benefits as well. So it's certainly a diet that I'm going to go back to, and I'm going to have a more focused form where I'm going to have more nuts in them. I'm going to have more fish, the fattier fish when I use this formulation. So I think it's. I'm not interested in eating butter. I'm not interested in just adding oils to my food. I'm not interested in having a steak at this point in time. So you have to. But I think it's worth trying a form if you'd like. And like anything, is that all diets can be very successful and all diets can fail. So it's good to try different things. That's why we have these 30 days to help you. And for those who are interested, this February 1st, the Weight Loss Club and I are just starting a 30-day healthier diet. And the first 2 days is a 2-day fast. So that's going to be a challenge, and we're going to do some intermittent fasting along the way too as well. So we're going to have some 16-hour fasts along the way. And my biggest downfall is that I love carbohydrates and I'm a nighttime eater. So those are the things I still still struggle with, and I'll keep struggling. I'll keep working on that. Thanks for sharing that.
So now for this section, we're going to have Chad have a little guest speaking moment right here. He's prepared some presentation for us, a really short one, but please welcome Chad, and yeah.
Well, thank you. It's always a pleasure to be a guest speaker with all of you. So this segment is foods rich in the antioxidants. So foods that are abundant in micronutrients and antioxidants, it's really important to keep your immune system strong, especially with the pandemic and this is flu season just for a regular flu, but any other types of diseases, you need to keep a strong immune system. So you want to focus with foods that that have antioxidants that will kill off free radicals, which are highly unstable molecules, like they're the toxins, and they'll cause extra damage to your cells. It's thought to be a role in a variety of diseases, including cancer, cardiovascular disease, diabetes, Alzheimer's disease, Parkinson's disease, your eye diseases such as cataracts and age-related macular degeneration. Next, please. So how do we kick the butt of free radicals from our bodies? By doing a couple simple things, actually. You need to care for your body by ingesting more foods rich in antioxidants. They'll be doing the butt kicking, and then we feed your cells with lots of micronutrients to keep your cells nice and healthy, to prevent any more intruders or cell destroyers. Well, you're always going to get those toxins and those cell destroyers, but if you keep your cells very healthy and strong by what you're consuming, there'll be less damage. So your micronutrients, what and why are they important for our health and well-being? Well, how and where do we get them? There are two major classes of nutrients in food. There's macronutrients and micronutrients. The macros means big, and macronutrients take their name from the fact that they make up the bulk of the nutrition in the food, which is your carbohydrates, protein, and fats. These nutrients supply your calories and serve as the building blocks for muscles and tissues. In comparison, though, the micronutrients are individual vitamins and minerals. This is what really feeds those cells and keeps them really healthy. A great way to get the right balance of both macros and micros is to follow a plant-based diet and to vary your intake of different foods. Plant-based diet like the popular Mediterranean, DASH, and MIND diet serves up a range of foods such as whole fruits and vegetables, legumes, whole grains, and lean sources of protein, along with healthy fats from such sources as nuts and your olive oil that we've mentioned earlier. Next slide, please. So choosing a diet made of nutrient-rich foods or nutrient-dense foods are low in sugar, sodium, starches, and fat, and bad fats. They contain lots of vitamins and minerals and few calories. Your body needs vitamins and minerals known as micronutrients. They can reduce your risk for chronic diseases. Getting them through food ensures your body can absorb them properly. Examples of foods containing micronutrients and considered most nutrient-dense foods are things like such as your garlic. It's jam-packed with all kinds of different things such as your antibacterial, antifungal. It's rich in vitamin C and your other vitamins, including potassium. It's been studied to actually lower blood pressure, so that's great. You've got your potatoes, high in potassium again, and magnesium. You've got other minerals in here, which is your iron and your copper and your manganese, which is all important for your body as well. And then some great antioxidants, which is your C and B vitamins. Dark chocolate, as we know, it's always been spoken about as great range of antioxidants. Spinach is great with your potassium. It's rich in vitamin K and your vitamin A, manganese. Also a great source of your iron. Brussels sprouts, which is another favorite of mine, which is vitamin K, and you got your A and your B6. Once again, potassium, manganese, your needs for the day there. The Brussels sprouts is jam-packed with it. So, micronutrient-rich foods with antioxidant properties. Also continuing on, we've got almonds, your nuts, your sunflower seeds. Both are really great in your vitamin E. Once again, that's an antioxidant, helps detoxify the body from the toxins that are in there and help prevent the damages to your cells, along with a bunch of other nutrients. Cauliflower, which is really high in vitamin C, your vitamin K once again, and really good with your fiber and some other things such as your thiamine, protein. It's got protein, niacin, and your magnesium. Strawberries are great as an antioxidant. Once again, we've got for your legumes, black beans, which are high in protein and iron. Great minerals like your copper, manganese, and thiamine. That also has phosphorus and magnesium in it. Tomatoes, great antioxidants, which is your A, your C. Also has vitamin K, some copper, potassium. Some unusual stuff, which is heart healthy, which is your lutein, and then it also has biotin in there. Next, please. So, and then one of the last slides here, bok choy. But bok choy and your spinach are very similar, which is a cruciferous vegetable. Superstars with bok choy are known as that. It's a Chinese cabbage. It's a powerhouse of vitamins A, C, and K. It's also got your calcium in there, iron, your B vitamins. The nutrients are rich for your heart and kidneys and muscles to function properly. And you can eat the whole stalk, the leaves, all raw in a salad, added to a soup, or quickly seared and stir-fried. So, yeah, it's always important to keep that in mind, is all your fresh fruits and vegetables, because that's what really feeds the body the nutrients that it really needs. So I always think when you're eating, is this packed with nutrients, or is it that processed food that you just got to take out that might not have as much rich nutrients in it that will feed your cells? But that's about it. Thank you.
So, Chad, I gone shopping a couple of times, and some of the things that I've changed is that I buy bags of spinach, and I put a lot of extra broths and things, and I love blueberries and different berries and things, and we mentioned things like oatmeal. So one of my treats is just baking frozen blueberries and oatmeal, and put some chia seeds and a few chocolate chips, of course, the dark chocolate, and but I still struggle by eating too much, maybe too much of the right food sometimes, and I miss some of those that processed food. But I really tried health, and thank you for sharing that.
Oh, my
And if anybody wants to be a vegetarian, Chad's going to lead a group that can show you how to do that. Then very inspiring. Thank you. And actually, all the speakers are inspiring. Thank you.
So next we'll be talking about healthy eating and motivation. So to change your diet and make those healthy changes, it might be different from what you're used to doing, and that can be hard to do. So we're going to talk about a few tips to keep yourself motivated to eat healthy and continue to eat healthy. So the first one is to concentrate on foods that are good for you and the benefits that they offer. So if you're making switches in your diet and adding in more greens or more vegetables or more nutrient dense foods that are recommended, what you can do is try to focus on how good those foods are for you and keep that in mind, so that you're a little more open-minded when consuming those foods and you feel a little more motivated to eat them if you know all of the benefits that they offer. The next thing is that you don't have to cut out foods you like. Just reduce your consumption or switch to healthier alternatives. So, for example, if you're a really big fan of pasta, then think about going for whole grain or whole wheat pasta instead of white pasta, and think about reducing the portion size that you consume. If you really like eating meat, maybe think about leaner meat choices that you can incorporate into your diet. So you're still getting something that you like, but not necessarily having all of those calories and all of those unwanted nutrients, and downsides that you don't necessarily want when you're trying to make a positive change in your diet. Next, it's important to pay attention to the speed at which you're eating. So some studies have shown that quickly eating or like inhaling and gulping down food can be a sign of bad eating habits. So just keep that in mind and pay attention to that as you go about making changes to your diet. Okay, so next, some of the recommendations are stop eating out of routine, temptation, boredom, especially during this time when we're all kind of stuck at home. It's so tempting to kind of go to your pantry, rummage around, get a snack when you're feeling bored or don't really have anything to do, or, it's just that time of day when you would normally get a snack. So pay attention to your body's hunger cues. Think about why you're eating and keep that in mind as you go about making changes in your diet. If you notice that you're snacking out of boredom, maybe find other activities to occupy yourself so that you don't feel the need to constantly snack, or maybe go for some of those cheat meals or temptation foods. Next is finding healthy recipes and ideas you like to make cooking more enjoyable. When you're changing your diet and you're looking to make some positive changes and incorporate healthier foods, one of the best options is to just make a lot of your meals home cooked. By cooking at home, you eliminate so many added preservatives, you eliminate a lot of processed food, you even reduce the sodium in your diet just because you have control over what's going into your meal. So a great way to get you on the bandwagon of cooking at home is to find recipes and ideas you like. Find inspiration so that this process is fun for you, and that will keep you motivated. And directly related to that, don't be afraid to try new foods. Be adventurous, be open to trying new things, and that can help keep you motivated to eat healthy. And on that note, enjoy your meals so you don't feel deprived. So incorporate things that you like, try to find the healthier alternatives, make structured meals that follow the guidelines but are also appealing to you. And that's key because so much of changing diet seems to rely on depriving yourself. And when you get into that mentality of, oh, I'm depriving myself of this or I'm depriving myself of that, it can make you feel really negative about the way you're eating and the diet that you're eating, which can sometimes lead you to fall off the diet. So motivating yourself largely has to do with enjoying what you are eating and enjoying the experience. You don't feel like you're taking something away. And the next point is recognize why you're eating. So I kind of mentioned it when I talked about routine, temptation, and boredom, but recognize what's the source of your eating, why you feel the need to eat certain foods, why you're feeling certain cravings, and identifying that can help you understand where you need to make changes and how you can make changes that will keep you motivated by addressing those particular cravings or what you're eating. So when talking about building habits about healthy eating, it's important that you set small measurable goals that will help you get to your overall large goal. So if your large goal is to ultimately go on a plant-based diet, maybe start small, thinking that I'm going to incorporate a green vegetable into every meal. And as you do that, you can build off of that, and it really makes it easy for you to get on the right foot and start, rather than having to tackle a big change right away. And next is enlist support from the people around you. So if you have someone who wants to try the diet with you, if that's a partner, a friend, a family member, do it with them. Find ways to eat healthy and make healthy foods together. It's great to have a support system, and that can give you all the more motivation as you're making this change. So if there's someone who wants to try it with you or someone who's interested, feel free to do it together. It's all the more fun. And lastly, don't let a setback keep you from your goal. Forming habits and habit acquisition is hard. It takes time. So if you have a false start or if you get off track, that's okay. Recognize when you get off track and why you got off track, and just keep the overall goal in mind so you're able to get back to it.
So now I'll just be talking about fast food, and for those who are busy and don't have time to prepare meals beforehand, fast foods are a convenient option. However, they aren't the best choice when it comes to our health. So on this slide, I have some tips and advice if you do choose to eat fast food. One is choose foods that are low in fat and higher in fiber and protein, and replace refined grains with whole wheat buns or bread. Avoid French fries, onion rings, noodles, macaroni, cheese, and etc. Healthier sides include side salads with light dressing, fresh fruit, or plain baked potatoes. You can also pack your own sides from home, such as dried fruits, nuts, celery sticks, apple slices, and cottage cheese. For burgers and sandwiches, go for the smallest size. Consider ordering off the kids' menu for smaller portions and decrease calorie counts, or eating half your meal and saving the rest for later. Choose grilled or roasted meats versus fried or breaded ones, and stick to one burger patty. Avoid condiments such as mayonnaise and oil-based sauces. Ketchup and mustard are better options. And lastly, stick to zero-calorie beverages, no soda, fruit juice, lemonade, or shakes. Maybe try sticking with carbonated water. Next slide, please. So what are some options for fast food? First, yeah, you can try the grilled nuggets at Chick-fil-A. It's a high protein meal, and it's much healthier than fried chicken nuggets and can be paired with a side of veggies. It's 170 calories for 12 pieces and has 31 grams of protein, 4 grams of fat, 1 gram of saturated fat, 0 grams of trans fat, and 105 milligrams of cholesterol. The second option is the grilled chicken wrap at Wendy's. This wrap has a herb marinated grilled chicken breast and a flour tortilla with a crisp spring mix and shredded cheddar cheese. And when paired with a small cup of chili or a small side salad, you can keep your calorie intake for the meal under 500 calories. And this wrap is about 300 calories with 20 grams of protein, 13 grams of fat, 4 grams of saturated fat, 0 grams of trans fat, and 60 milligrams of cholesterol. The next option is grilled steak soft taco at Taco Bell, and this meal has avocado ranch sauce, cheddar cheese, lettuce, and tomatoes. It's 200 calories and has 12 grams of protein, 10 grams of fat, 3.5 grams of saturated fat, 0 grams of trans fat, and 30 milligrams of cholesterol. And lastly, another better option is the steak burrito bowl at Chipotle. With the steak burrito bowl, opt for pinto beans, salsa, and veggies. Skip the calorie-packed rice, cheese, and guacamole. So with these options, the calorie intake should be around 310 with 29 grams of protein, 7.5 grams of total fat, 2.5 grams of saturated fat, 0 grams of trans fat, and 95 milligrams of cholesterol.
So we're going to be ending off our presentation with how to eat healthy on a budget. So eating healthy doesn't have to cost more. There are many different healthy foods that can be used when eating on a budget, and lots of tips that you can follow as well. So first off, stick to the list. Buying only what is on your grocery list can help you cut down on impulse buys. You want to make sure you shop for sales. Check out flyers, coupons, mobile apps, and websites for deals on food on your list. And if you see that image to the right, I have the Flip app on the screen. And this is a really great app because it allows you to search for specific food items, and it shows you the deal on that item and exactly where to purchase them. Some of the stores on there, Walmart, Costco, anything like that. And you can even use Flip for price matching because it allows you to have these flyers right in your phone, so you don't have to cut them and flip them somewhere. It's a lot more convenient. So getting back into the tips, another way to reduce the cost of food is to get products that are close to their best before dates because they may be offered at a lower price. These products are just as healthy as the perfect varieties of food. Additionally, compare prices on generic and brand name products to see if there's any price difference. You want to stock up on canned goods and as they are on sale, and you can extend the shelf life of sale items by freezing them. You can freeze things like bread and really extend the shelf life. Also, fish, fruits, vegetables, lean meats, and poultry. In terms of fruits and veggies, they can be quite pricey, but you want to consider the season. Fruits and vegetables are less expensive when they are in season, and they're also more fresh, so you're getting the best of both worlds. And the last few tips that I wanted to mention is to choose plant-based protein foods such as beans, lentils, and other legumes. Use them in your meals several times a week, and you want to always limit highly processed foods as they're really not good for you, and you want to be getting away from eating things like that. They're usually low in vitamins and minerals and cost more. So if you go to the next slide, I have an image of your chart of fruits and veggies that are in season versus out of season. It's really easy to find. You just do a quick Google search of in-season fruits, and it's sorted by the season. Right now we're in winter. And as you can see, as we go from January into February, avocados, bananas, blood oranges, and clementines are in season. So what this means is that they're going to cost less and also be more ripe. So you want to pay attention to this when you're picking what fruits and veggies to buy. So we wanted to thank you for sticking with us through this long presentation. We've had lots of information in here, but we really hope that you learned something and took away from each of these little diet segments. Hopefully we helped you decide what diet you're interested in choosing. As Dr. Kearney mentioned, dieting takes a lot of trial and error, and you might need to try different things before you figure out what works. But ultimately, we're all here to support you, so please reach out to us on email if you have any questions. Thank you.
Absolutely fantastic. I thought that you guys you just guys nailed a lot of great points. There are lots of controversies, but I think you highlight is that is that you can do big changes. You can make one change at a time. You can have meatless Mondays if you wanted to. You can say, I'm going to not eat bread or pasta this week. I'm going to avoid alcohol for February. I'm going to put lots of, I'm not going to avoid all the liquid fats. And so many ways of doing this. And I think you highlighted so many ways. I want to emphasize is that diet is one of the pillars to health. And I enjoy eating, I enjoy cooking, but I'm a messy cook, and my wife hates me in the kitchen. But saying that is that there's so many tricks and different things, and I just want to thank people. Stuart, are there any questions or comments from anyone?
Yeah, there are a few questions. I just wanted to encourage everyone on WebEx, if you do have a question, you're more than welcome to put it in the comments below and we can get to it. We have two questions right now. The first one relates to diabetes. We have one patient who's wondering if a fast is something that they can do if they have type 2 diabetes.
Sure. Basically, in type 2 diabetes, there's two components. One is the insulin resistance, and in fact, most type 2 diabetics are in that phase right now, and so fasting is terrific because by that way, your body will become more sensitive to food, and you'll be better off. You might have to measure your blood sugar a little bit more often, but it may make some adjustments and medications as necessary. So that's a good change to make. So if you're doing so well on that, and it depends on the medications you're taking. If you're on insulin, for instance, or a medication called sulfonylureas, that will take more adjusting. If you're on something called SGLT2 receptor antagonist or glucagon agonist, you don't have to change anything because your body will adapt to that on its own. So sure. And to me, it's that I really like the motivation part as well, because there are times we're going to have problems and getting yourself back on track. So thank you for sharing those moments. And if people want to ask some questions on WebEx and unmute themselves, that would be great. I'll ask Chad if he had any other further comments or questions. Chad, what did you take away? What are you going to try differently?
I'm going to stay really focused with all the different foods that focus on inflammation, get inflammation out of the body, and stuff that the nutrients that will help keep my immune system strong, and stuff like that. Yeah, I'm very pro eating lots of healthy whole foods.
All right, great. What other questions were there, Stuart?
Yeah, absolutely. So this is a question that Chad, you might be able to pitch your input on. We had one patient who asked, now everywhere we're all talking about organic foods, but I can't get organic foods all the time because it's expensive. Because of this, I might not get the vitamins that these processed vegetables have. Do you have any advice when it comes to shopping, finding reasonably priced vegetables, or should anyone be concerned about the difference between organic and processed vegetables?
Okay, well, the person asking the question is very right. It can be very expensive, and I'm not really clear myself on the benefits that the benefits really outweigh that much as the organics of today. There are a lot of yeah, it's expensive, and I'm completely clear. So they say that if a field is getting fertilizer, and there's other toxins, another small piece of land next door to that that's contaminating, the wind can actually blow it over X amount of kilometers onto someone else's land that they're growing organic. So the soil is very important, but I think that's it's a personal choice, and me, I don't emphasize on eating organic all the time, but you can find some deals on the organics as well. That answer. I know it was a little around the pub, but
So we're still learning a lot, but to me, the nutrient content between organic and non-organic are really the same. It's basically the chemicals that are added to the environment, the processing, and potentially other carcinogens that you get from certain foods. So one thing to remember is that certain foods are more important to be organic or non-organic. So things like that have like peels on them, bananas. It doesn't really matter if it's an organic or non-organic banana because you're not going to eat the peel. Same thing with the orange. Or things like berries and strawberries where it's harder to get the pesticides off, that may play a bigger role. So there's reasons to think of organic for the environment and for pesticides. But for nutritional value, there's no difference in nutritional values. The thing that's most important for nutritional values is to eat them fresh, frozen, are good as well. So that's the way I look at it. And I know there's, again, another controversial, like everything in food. And in fact, the science of food is the science of controversy. So you have to try to make sense of this. So be attentive to cost and be attentive to the environment as well. And we're learning all the time. I'll just see if anybody in the group wanted to add some final things that they wanted to bring out, because I truly enjoy this presentation. Everybody brought something out. Does any of the participants want to say any last words that they wanted to add, or are they satisfied with everything I said? Because I can always think of 5,000 things I want to say afterwards. So anything else anybody wants to add? I guess everybody's happy. So what I'm going to give, I want to thank everybody for participating and all the work behind this. Stuart, I'll give you the last word.
Well, I always like to start off my last word by, of course, thanking everyone involved in putting together this week's presentation. So I just, of course, wanted to shout out Shannon, Aditi, Helena, and, of course, Steffi for putting together a phenomenal webinar. I think this was an important one for our page. There's so many different diets out there. Sometimes it can get quite confusing, I'll be honest. So it's nice to actually have touched upon a few of them. Of course, we didn't touch upon all of them. There are many more out there, but we touched upon some common ones that are important for you to at least consider and recognize. And you can take little bits from each one and figure out what actually works best for you. I really appreciate what Aditi did talking about a motivation. As Steffi said at the end, picking a diet that's right for you is a lot of trial and error. You're obviously not always going to get it on the first time, but with each failure, you kind of learn a little bit of something new about yourself. And you can start reframing these things and not seeing them as failures, but just learning opportunities to say, okay, that didn't work, but I learned something here and I can try something new. So overall, I thought it was a phenomenal webinar. And I just wanted to remind everyone who's actually listening as well that we do have focus groups as well. We have a focus group for weight management focused on healthy lifestyle changes. They meet on Zoom on Tuesdays at 7 o'clock. If this is something that interests you, we would love to have you join us. So if it is something you're interested in, you can always email us at drkerner232@gmail.com, and we'll be able to give you a call, and we'll see if it's something that is right for you. Of course, we always want to motivate you, and we want to be as helpful as we can. So if you want to be involved and you want us to be involved in your care, please take that step.
And remember, friends, enemies, spouses, everybody is welcome to participate. And we're also going to be starting shortly on Wednesdays at 7 o'clock a exercise club, an exercise session where we can maybe exercise together on Zoom, eventually in person. And we're also going to have once a month on Wednesdays at 6 o'clock, usually last Wednesdays every month, is that we're going to have a sugar workshop and different areas in that area. So we're working hard to work with you in different ways and try different things. So to me, I've tried different diets. I'm going to try some other ones, and I want to bid everyone a great night and look forward to our next session. And I'm going to stop and look at this and rewind this multiple times. Good night, everybody.